Part of the reason why I came to Jeff City is I wanted to be able to take care and keep these athletes in Jeff City that were having to leave to get the health care that they were needing. I'm really trying to, from my perspective, really creating a good sports medicine network in this area so athletes can get taken care of and they can benefit from high quality level care. I know that we can provide that quality care here, and if we're available for people to provide that care. My name is Kevin Middlemist. I'm an orthopedic sports medicine surgeon at JCMG Orthopaedics and Sports Medicine. Primary reason that drove me to becoming a doctor is I had a couple injuries when I was in middle school and high school that ultimately led to have interactions with orthopedic surgeons. Going through the rehab and recovery process from those injuries, I got to work with the doctors and physical therapists, which piqued my interest in orthopedic surgery specifically. As I went through college, I knew that I wanted to become a doctor. I enjoyed helping people and impact their lives from a medical standpoint. And then right before I started medical school, I had an ACL injury in college. As I went through that surgery and recovery right before I started medical school, that kind of really cemented to me that orthopedic surgery was kind of where God was leading me to be pushing forward my career. I think the number one thing I like about Jeff City the most is it's a big city, but it's got a small town feel. It's a very close-knit community where you know your neighbors, you know who lives down the street. And growing up in a small town of only a few thousand people with 2 stoplights, I'm used to that kind of atmosphere, and I never wanted to go back to a large city because I don't want to feel like I get lost or I'm just another person in the city. I want to feel like I can make an impact, and being able to practice medicine in a small community like this, I feel like I'm making a difference. Healthcare can be daunting. Hospitals can be daunting. When you come see a doctor, it can be overwhelming of where to park, where to go. And so my whole mindset is trying to make it as easily accessible as possible and trying to make it as easily not intimidating. Most people feel like they don't know what's going on, that doctors talk over them. And so my goal as a physician is to be as transparent as possible about what your condition is. So that way we can work together as a team to get you better. And I think as far as JCMG goes, I think most of the doctors there, that's what our goal is to do, is to create a healthcare network for patients moving forward. I think the best part of my job is being able to impact people in their physical lives. Activity and motion is what makes life and the ability to be life special. And when we lose that ability to be active, when we lose the ability to be in motion, our lives take a hit. And you see that in day-to-day lives where people, they become depressed and they lose that activity level. And so that's probably the most rewarding thing to me, to be able to be a part of that equation to helping them get back to where they need to be.